Hi students, the next topic is ABG analysis, that is arterial blood gas analysis, right? Very important short notes from acid base balance. Okay, so the assessment of ABG, usually the artery is radial artery, the next choices are brachial artery and femoral artery. Anticoagulants role is very important. You should be carefully select the anticoagulants for ABG analysis. What are all the indications why you want to go for ABG analysis? That is respiratory failure, renal failure, cardiac failure. Three important systems failure. Then ventilated patient, then poisoning cases, any poisoning cases admitted in ICU or emergency ward, sepsis and burns patients. These are all the indications for acid base ABG, arterial blood gas analysis. ABG means arterial blood gas analysis. It is a common investigation in emergency department and ICUs for monitoring the patients with acute respiratory failure. This is the introduction you have to write for ABG analysis. Okay, arterial blood gas analysis. It is a common investigation in emergency ward and ICU setups for monitoring the patients with acute respiratory failure. Okay, it is actually invasive procedure. You have to take the blood from radial artery. Okay, why ABG is important? Number one, find out how the lungs are delivering oxygen to the blood circulation. Second one is it assesses the balance of acids and bases in the blood circulation. Third is it helps to evaluate the lungs, how it removes the carbon dioxide molecule. It is a waste product from all the three metabolisms. These three are the important functions for why you want to go for ABG, right? Next one is what is a clinical importance, significance? It helps in confirming the diagnosis by the clinicians. This is for clinician, confirmation of the diagnosis. Second one is it guides treatment plan for the patients. Third one is it helps in ventilator management, right? In already in ventilated patients, how you have to alter the treatment or change the management like that. Fourth one is to find out the improvement in acid-base management for the ICU patients. These are all the clinical importance for ABG, that is arterial blood gas analysis. Okay. Now coming to the what are all the parameters for ABG? Actually, we have 4 plus 3 parameters like that. First 4 is related to acid-base balance. Next 3 is coming under electrolytes, right? Electrolytes, you already know sodium, potassium, chloride. The normal values are sodium is 135 to 150 milliequivalents per liter. The unit is very important. Potassium is 3.5 to 5 milliequivalents per liter and chloride is 95 to 105 milliequivalents per liter. Coming to the acid-base parameters, the first one is pH, that is 7.35 to 7.45. Here there will be no unit. Next one is PCO2 and PO2 gases. That is PO2 is 95 to 105 millimeter of mercury and PCO2 is 35 to 45 millimeter of mercury. The last one is very important buffer system bicarbonate 22 to 26 millimoles per liter. So first you have to describe what is ABG. Second one is what is the importance. Third one is how it useful for the clinicians. Next one is what are all the parameters involved in arterial blood gas analysis. Okay, bye.